dear students, myself Bhavani Pintela, working as an assistant professor in Noida Institute of Engineering and Technology, Greater Noida. And here in this lecture, we are going to discuss about adverse drug reaction. This is my 18th lecture in the unit number 2 with the subject code BP404 and the subject was Pharmacology-I. So, without any further delay, we are going to dive into the class and we are going to discuss about what the adverse drug reaction will be seen in with the drug. So, what is an ADR? So, before discussing about the adverse drug reaction, we have to know about an ADR. So, WHO has been defined. What is an ADR? Adverse drug reaction. It is a response after taking of a drug which is an noxious or it is an unintended or it will be happened abnormal after taking to a particular condition like prophylaxis or to diagnosis or to treat the disease or to modify the physiological function. So, this is the definition of an ADR. The WHO has been defined the response of a drug which is noxious and unintended which occurs at the dose normally in the particular man who has been taken to diagnosis or in prophylaxis condition or to treat the disorder or to modify the physiological condition. So, what are the causes of an ADR? So, ADR here in this slide we are going to discuss about what are the causes and what are the factors affecting the ADR. So, what are the causes? The main causes was fail to take the correct time. So, some people what they will do? They do not take the dose in the correct time. The failure of a dose in the correct time is also one of the cause of an ADR. And if the particular person have taken the overdose, the dose what has been doctor prescribed in that dose, if you have taken an extra dose, if you are administering the overdose and little bit increased in a dose which can causes the ADR. And if you are taking the medicine that which has been prescribed for the some one person. So, if you are taking the prescription of some other person, it can also causes the ADR. And if you are taking this, if you are taking the other drugs or preparations which interacts with the medicine, you are taking the one medicine and you are interacting with the another medicine. So, definitely it also will causes one of the adverse drug reactions. And another important cause of adverse drug reaction was it will combining the medicine with alcohol. If you are combining, if you are taking the drugs with alcohol, if you are combining the drugs with alcohol, definitely it is going to causes the adverse drug reactions. All these are the causes with the ADR. And what are the factors that affecting the ADR? The sex, age, diet, what the diet you are taking and the smoking, genetic influence, previous adverse drug reactions, total number of medicines, how many medicines you are taking, and in such condition also the factors will going to affect the adverse drug reaction. And finally, concurrent disease and what the disease. So, what the disorder do you having, either it is a renal or liver or cardiac or gastrointestinal, what the disorder you having, in such a condition also definitely it is going to modify the adverse drug reaction. So, it is one of the factor that going to affect the adverse drug reaction. So, here when you had administered the drug, definitely the drug it will bind to its receptor and it will shows the pharmacological action. So, when the drug bind to the receptor it will shows the pharmacological action and at the same time it can shows us the undesirable effect also, the pharmacodynamic effect. So, what is a pharmacodynamic effect? What is the pharmacodynamics? What the drug does the body after entering of a drug inside the body, what the drug is going to do within the body, what the changes, what the drug is going to bring the changes inside the body is called as a pharmacodynamics. So, what are the pharmacodynamic effects? What are the changes bringing by the drug with the pharmacodynamic effect? It may be desirable and it may be undesirable. So, if it is a desirable effect, nothing to worry there, and if it is undesirable effect which you can call as an adverse drug reaction. So, if you had taken any drug which causes the undesirable effect, so what is going to happen? We will discuss one by one here. Here the pharmacodynamic effect of a drug has been classified into two types, desirable and undesirable. Undesirable drug effect like adverse drug reaction is further classified into three types. One is expected undesirable effect. You can expect after taking of a drug, you can expect what the disorder is going to happen, what the adverse drug reaction is going to happen here. So, what is the second one? Second one is unexpected undesirable effect. Here you cannot know what the undesired effect you has been produced by the drug, and third one is the others. The first one, expected undesirable effect, you can see that type A And unexpected undesirable effect you can discuss here with the type B adverse drug reactions and others where you can see the type C, type D, type E and type 4, and I will explain all the types in the forthcoming slides. And what you can see in the expected desirable effects, you can see the side effects, you can see the secondary effects, you can see the toxic effects, right. And what about the undesirable unexpected effects? Here you can see the hypersensitivity reaction, idiosyncrasy, right. You can see some adverse drug reactions, genetically observed adverse drug reactions. So, this is about the pharmacodynamic effect of a drug. We will discuss one by one in each. So, first one, depending upon how many types the ADR has been classified, depending upon the type of reaction, depending upon the severity and depending on the basis of onset of action, the adverse drug reactions has been classified. So, first we are moving to the first type. What it is? The type of reaction. Which type of reaction has been shown by the drug? The adverse drug reaction has been classified into 6 types. What are they? Type A, type B, type C, type D, type E and finally type F. Type E and finally type F, and this is the classification which falls under types of reaction. And what is the second type of classification? Based on the severity, the adverse drug reaction has been classified into mild, moderate, severe and lethal. And depending upon the onset, on basis on onset of adverse drug reaction has been classified into acute, subacute, latent. Okay, these are the 3 types of classification where the adverse drug reaction has been classified. So, we will see here the type A. What is the type A? What the A represent here? The A represent augmented. What is the B? Bijaris. What the C represent here? Chronic. If you are administering the chronic dose of any drug. And D, delayed. E, end of any therapy and failure of any therapy, end of any dose, end of any drug and failure of therapy. So, which we will discuss one by one in the upcoming slides. So, what is the first one? Type A adverse drug reaction depending upon the reactions. The type A adverse drug reaction which you can call as an augmented, and here this type of adverse drug reaction was a predictable, less mortality, and these are the more common adverse drug reaction you can be seen with the drugs, and which is related to the dose, what the dose you are giving to the particular person. And here how can you prevent the adverse drug reaction? How can you prevent the type A adverse drug reaction? By adjusting the dose regimen. By adjusting the dosage regimen, definitely you are going to prevent the type A adverse drug reaction, which you can call as an augmented adverse drug reactions. Okay? And what are the examples falls under type A? For example, if I am giving the benzodiazepines, benzodiazepines is a sedative and hypnotic drug, and what is the side effect? What is the adverse drug reaction you can see with the benzodiazepines? You can see the sedative action. Even with the barbiturate also will causes the sedative action. Right, furosemide, what the drug it is? It is a diuretic drug. Which type of drug it is? It is a high ceiling diuretic drug. So, when you had given this furosemide drug, and what is the adverse drug reaction you can see here? What the type A adverse drug reaction you can see here? Water and electrolyte imbalance. And next one is heparin and warfarin. These are the anticoagulants. When you had administered here, it can causes the type A adverse drug reactions like spontaneous bleeding. And the last drug was insulin. When you had administered the drug insulin, it can causes the hypoglycemic affection. It can induces the hypoglycemic action. This is one of the side effect. This is one of the adverse drug reactions which falls under type A adverse drug reaction. And this is not much more harmful to the person. These are the predictable. These are the more common adverse drug reactions. The mortality will be very less, but the only thing we can do here, we can adjust the dose. And second one is the type B adverse drug reaction, which you can call as an Bijari. And here what is going to happen? This is uncommon adverse drug reaction. These are unpredictable, and what is going to here the mortality rate will be increased. As if you didn't sort out the side effect of a particular drug, sometimes it can causes very serious side effects. For example, if I am taking the drug like penicillin, the penicillin is in a drug which will causes the serious adverse drug reaction like hypersensitivity reaction, which can causes the anaphylactic reactions, which will causes immunological reactions to the penicillin. And second one was an idiosyncratic reactions, malignant hyperthermia with the general anesthetic. So, if I am administering the general anesthetic can causes the malignant hyperthermia, which is an idiosyncratic reaction, which is a very serious idiosyncratic reaction which can caused by an general anesthetic, which will falls under the type B. So, what you can do here? So, how can you manage the type B adverse drug reaction? So, here you have to withhold the drug or you have to avoid these drugs in future. And next one, type B adverse drug reaction, which you can call as a continuous or chronic. And what is going to happen here? When you had administered the drug in a continuous therapy, or if you had administered drug in a chronic therapy, the long term effect of a drug is going to show the type C adverse drug reactions. For example, if I had administered the ethambutol in a long therapy, in a chronic therapy, which can causes the retinopathic adverse drug reaction. If I had administered the NSAIDs drugs, non-steroidal anti-inflammatory drugs in a chronic exposure, which can causes the nephrotoxicity. And like a AKtU, if I am taking the AKtU drugs, which can causes the colic dysfunction. So, the colic dysfunction is an adverse drug reaction, which is a type C adverse drug reaction by the AKtU drugs. So, for example, if you see here, osteonecrosis of a jaw with the biphosphate, if I am administering. So, this is a condition where you can see if I am administering the biphosphate is a drug which can causes the type C adverse drug reaction like osteonecrosis. Okay. And what you have to manage here, what the management you can do here. So, you have to reduce the dose, or you have to take in a alternative therapy, or you have to withdraw, maybe the withdrawing may have to be prolonged. So, suddenly you have not, suddenly you should not withdraw the drug, withdrawing may have to prolong. And next one, type D adverse drug reaction, which are uncommon, usually dose related and occurs sometimes after use of a drug. Type D, which you can call as a delayed, the action will be shown after taking of a drug, the delayed action. For example, type 2 dyskinesia. So, this is an adverse drug reaction which has been shown in a delayed process. For example, carcinogenic drugs, teratogenic drugs like thalidomide. The thalidomide is a best example which falls under type D drug reaction. Thalidomide is a drug which has been prescribed to the pregnant woman for an anti-emetic condition for a first trimester. So, the thalidomide is used for the morning sickness, for usually it has been given to the pregnant woman who having emesis problem. In such a condition, the pregnant woman has been taken the thalidomide. So, the woman do not causes any adverse drug reaction when she had taken such a drug, but that adverse drug reaction has been seen to the fetus like baby, which causes the hind limbs. There is no hands and legs to the particular baby who had taken the thalidomide drug to the pregnant woman. So, what the effect you had observed here, the delayed effect, the drug has been taken by the mother, and what the effect you had been seen, the effect has been seen to the baby. So, the effect will be, the effect of a drug has been delayed. So, this is comes under type D adverse drug reaction. So, it is an often intractable adverse drug reaction. And next one is a type E adverse drug reaction, which you can call as an ending of an dose. If you are ending the dose in such a condition, the adverse drug reactions you can see, which you can call as a type E adverse drug reaction. These are very uncommon, and this type of adverse drug reaction you can see when you are withdrawing the drug. At an end of a dose, you are withdrawing a drug. In such a condition, you can see the type E adverse drug reaction. For example, if I am stopping, or if I had withdrawn the drug benzodiazepines, so what is going to happen in rebound insomnia? So, for what I am taking the benzodiazepines? So, what we are taking the benzodiazepines in such a classification falls under sedatives and hypnotics, right? It is a sedative and hypnotic drug. It is used to induce the sleep. So, the benzodiazepines are the drugs that induces the sleep. If you are suddenly withdrawn the drug, which will rebound the insomnia, anxiety. Okay, clonidine or beta blockers, which can rebound the hypertension. So, you should not suddenly withdraw the drug. So, what you have to do here? You have to slowly withdraw the drug. Next type of adverse drug reaction was the type F adverse drug reaction, which can causes the failure of therapy. So, this is the next name of type F adverse reaction, failure of efficacy. So, what is here? It is a common dose related underdosing of a medicine. If you are taking the medicine in a low dose, if a doctor has been prescribed to take the dose for 2 times, so you have taken for a single time, definitely underdosing of a medication can causes the type F adverse drug reactions, and this type of adverse drug reaction mainly due to because of drug interaction. If you are combining the drug with another drug, the type F adverse drug reactions you can see. For example, if I can say you the best example I can give you here, oral contraceptives. So, oral contraceptives is a drug which we are taking to prevent the pregnancy. The oral contraceptives are the drugs used to prevent the pregnancy, and if I am taking this oral contraceptive with any enzyme inducer, for example phenytoin. So, any enzyme inducers, if I am taking the oral contraceptives with an enzyme inducer, so what the enzyme inducer will do? The enzyme inducer will induce the enzyme and it will increases the metabolism of any drug. So, now the contraceptive drug, oral contraceptive drug, due to because of induction, enzyme induction, the drug will be get metabolized very fastly. So, if the drug metabolizes very fastly, and how it can and how the drug can shows its action. So, you can see the failure of efficacy. So, this is the example of any failure of efficacy, and the resistance to the antimicrobial resistance. So, if you are administering the antimicrobial drugs, it can causes the resistance. This is also the another example which falls under type F adverse drug reaction. So, what you have to do here? You have to increase the dose and you should not take with the combination. And next, depending upon basis of onset of action, the drug has been classified, the adverse drug reaction has been classified into acute, subacute, latent, right. Acute, here the adverse drug reaction you can be seen within 60 minutes. For example, anaphylactic shock, nausea and vomiting, bronchial constriction. So, if I had administered any drug, for example, I had administered the drug like histamine. So, what the histamine drug will cause here? Histamine drug can causes the bronchial constriction. It can causes the anaphylactic reactions. So, if I am taking any another drug which can induces the nausea and vomiting, so like morphine it can induces the nausea and vomiting. So, this type of adverse drug reactions you can see within 60 minutes. So, these are called as an acute adverse drug reactions. And what about subacute adverse drug reaction? Subacute adverse drug reaction you can be observed within 1 to 24 hours. So, after taking of any drug 1 hour to 24 hours in between you can observe the subacute adverse drug reaction. What effect you can observe here? Serum sickness, or if you are taking any antibiotic associated diarrhea, all these are the effects which you can see with the drugs which can causes the subacute adverse drug reactions. And last one was the latent one, which you can observe the adverse drug reaction greater than or more than 2 days. After 2 days or more than 2 days you can observe here, and what is going to happen directly here? The organ will be get damaged, that organ toxicity will be seen, the condition will be get very serious in the latent adverse drug reaction. And basis on severity, the drug has been classified into mild, moderate, severe and lethal. And mild adverse drug reaction is every drug having its own side effects. So, if it is in a minor, no need of hospitalization, then it is called as a minor adverse drug reaction. If it is moderate, so by the hospitalization the person can get treated. Okay, in severe condition, what is going to happen in severe condition? Here it causes the permanent damage inside the body, it can causes permanent damage to the organs, right. And finally, lethal effect, here that directly or indirectly the person can die. So, which can causes the lethal effect of any drug. So, sometimes the adverse drug reactions which may leads to the lethal effect. And next one, adverse drug reactions has been categorized into side effects. So, first one, side effects. So, for if I am taking the drug atropine, what the side effect of atropine you can see here? It can causes the dryness of any mouth. For example, if I taken the cough syrup, for example, codeine is an antitussive drug, okay, which is used to treat the cough. And what is the side effect of any codeine? The codeine which one causes the constipation, right. So, undesirable effect will be seen at the therapeutic dose. Even if you have taken in a therapeutic dose also, the drug is going to show the undesirable or unexpected effects or adverse drug reaction for a particular dose. So, here undesirable effects you can call as any side effects. And next one, secondary effects. So, what is any secondary effects here? The secondary effects here, the suppression, for if you had given the antibiotics to suppress the microorganisms, okay, and what the antibiotics will do here? It will suppress the microorganisms, and apart from that it will suppress the bacterial flora. For example, I had given the tetracyclines. What the tetracyclines have to do? The tetracyclines having the bacteriostatic action. It will kill the microorganisms. It will destroy the microorganism by suppression of by giving of these tetracyclines, which will causes the suppression of bacterial flora. So, this is a secondary effect. For example, corticosteroids, latent TB will be activated. This is the secondary effect you can see with the drug. And third one is toxic effect. The toxic effect of a drug, sometimes it may be suicidal or sometimes it may be accidental. How you can see the toxic effect? Sometimes the toxic effect you can be seen by the accidental or suicidal. So, here we will see about the toxic effects. If you had given the high dose of heparin, so heparin, which type of drug it is? It is an anticoagulant drug. If you had administered in a high dose, the toxic effect you can see like bleeding, right? And if you are administering the streptomycin in a prolonged therapy, in a chronic therapy, in continuous medicine, in a continuous administration, what is going to happen? It can causes the ototoxicity, it can causes the nephrotoxicity. And paracetamol, what is the paracetamol toxicity? If you are taking in a high dose, it can causes the liver damage. Barbiturates, if you are taking in a therapeutic dose, definitely it can causes the sedative and hypnotic action. As the dose increases, now you are getting now you had giving the dose in an increased manner. Now, the toxicity also will get increased to the particular drug. So, here the barbiturate dose has been increased, which can causes the coma, respiratory failure and respiratory depression. Sometimes the person can die also. And next one, digoxin. What is the toxic effect of digoxin? AV blockade. And morphine, what is the toxic effect of morphine? As the normally when you had taken the morphine, it causes the respiratory depression and central nervous system depression. As further you had increased the dose of an morphine, it can causes further depression of an respiration. It causes the respiratory depression in severe state. And what about the next one? Intolerance. Intolerance, what mean by intolerance? So, a characteristic toxic effect at the therapeutic dose. If you are seeing any characteristic toxic effects in the therapeutic dose, then you can call as an intolerance. For example, here if I am given the trifluoropromazine drug in a single dose, and what is going to see here? Muscular dystonia. Okay. Single dose of an chloroquine may causes the abdominal pain. Here you had given in a single dose, you had given in a single therapeutic dose also. In a single therapeutic dose also, it will show the characteristic toxic effect. So, here I am giving a single dose of the chloroquine drug. I am not increasing the dose. Here I had given only the single dose of the chloroquine drug. So, what is the characteristic toxic effect has been seen with the chloroquine? It can causes the abdominal pain. And next one was the idiosyncrasy. So, what is an idiosyncrasy? Idiosyncrasy is a genetically determined abnormal reaction to the chemical. So, if you are taking any drug or any chemical to the particular person, you can see the genetically abnormal reaction to the particular person. Here, if I am taking the barbiturate, which can causes the excitation or mental confusion. So, excitation and mental confusion will be different in some patients depending on the genetically determined abnormality levels. Okay, next one, chloramphenicol. It is what is the genetically determined abnormal reactivity you can see with the chloramphenicol? It causes the aplastic anemia in some patients, in some people, aplastic anemia. And the next one is photosensitivity adverse drug reaction. The photosensitivity adverse drug reaction, here the drug induced the sensitization to skin of UV rays. So, when you had exposure to the UV rays, here the drug can sensitize, here the drug can induce the sensitization of skin. Here the photosensitivity reactions has been divided into two types. What are they? One is phototoxicity and second one is photoallergy. So, we will discuss about the phototoxicity and we will discuss about the photoallergy. So, phototoxicity, what is in phototoxicity? Here in phototoxicity you can see the short wavelength, and the wavelength is about 290 to 320 nanometer, and it is in UVB, and this phototoxicity is caused by the UV rays B. Okay, and it is a more common example was tetracycline. And what about the photoallergy? The photoallergy was very less common, and the long wavelength, it having very long wavelength. If you am talking about the phototoxicity, it having the short wavelength, and photoallergy having the long wavelength, it is about 320 to 400 nanometers. Example was the sulfonamide, and what the rays you can see here UVA. Okay. And phototoxicity, what is the major difference between the phototoxicity and photoallergy? It is an a short wavelength, it is an a it is an a short wavelength, this is an a long wavelength. This is more common, this is an less common, right. It having 290 to 320 nanometers, it having 320 to 400 nanometers. Okay. It is UVB, it is UVA. Okay. And next one is allergic reaction. What is the allergic reaction here? The allergic reaction you can call as an hypersensitivity reaction. Here allergic reaction has been categorized into humoral and cell mediated. In humoral it has been again further classified into type 1, type 2, type 3, and finally type 4 adverse drug reaction was a cell mediated adverse drug reaction. In type 1 adverse drug reaction, the anaphylactic reaction is due to because of immunoglobulin E antibodies. Here you can see within 2 to 3 hours like anaphylactic shock, urticaria, you can see some hypersensitivity reactions, right. And what about the type 2? Type 2 is called as a cytolytic reaction. Type 1 is an anaphylactic, type 2 is a cytolytic reaction due to the antigen antibody complex, and which will develop within 72 hours. And what is the third type? The third type you can call as a retarded adverse drug reaction due to the immunocomplex. And what about the fourth type of adverse drug reaction or fourth type of an allergic reaction? It is a delayed hypersensitivity reaction, for example contact dermatitis. And next one is a drug withdrawal reactions. So, if you are withdrawing the drug, it can causes some adverse drug reactions, corticosteroids in asthma, beta blockers which can worsen the angina, and teratogenic. These are the drugs, students, which can causes the teratogenic action when you had prescribed to the mother. Thank you.